It's a pleasure to be here today and a great honor to be representing the University of Missouri-Columbia. And if I'm correct, we're one of the newest members, among one of the newest members to the SEC. Today, I'm going to be presenting some background on research that I've conducted over the last decade that looks at developmental consequences of the early onset and persistence of obesity and overweight. We've all become very familiar with the current prevalence rates of overweight and obesity in the population. We know that about 1 of 5 children between the ages of 2 and 5 are overweight or obese, and about 1 out of 3 of every 6 to 19-year-olds has excess weight. A recent study that was published earlier this year in the New England Journal of Medicine did an analysis of a longitudinal data set that was quite large, and they found that overweight kindergartners, and by that I mean the 85th to the 95th percentile, children who are overweight in kindergarten are 4 times more likely to be obese at the age of 14 than their non-overweight age peers. So we know also that overweight and obesity tracks considerably across childhood and into adolescence. I'm getting some feedback. I feel like we've had a great introduction to the idea that overweight and obesity affects all bodily systems. We heard about that from Dr. Hall yesterday when he accepted his teaching award, and we got even more information about that earlier from Dr. Southern's presentation about actual health-related consequences of obesity at the cellular and that level. I study child development, so I'm not good at that language. I'm going to be talking a little bit more today about psychosocial implications of overweight and obesity across childhood and the implications of challenges for children in terms of their academic abilities and performance. One of the things that I like to talk about when I teach on campus at the University of Missouri is the implications of childhood obesity for human capital formation. And I'm not going to go into that too much today, but it's a concept that applies very, very frighteningly well to what happens to children who develop excess weight early in life and keep that on. I want to give some background about theoretical perspectives on the period of life that we call middle childhood. And middle childhood is basically the years of about 6 to 12, when kids are in kindergarten through probably the end of 5th grade and before they go on to middle school. 3 pieces of information, theoretical information, that are particularly important to keep in mind. The first is the Ericksonian stage of industry versus inferiority. During this period of life, we know that children are really challenged to understand things about themselves in terms of their developing sense of competence. And competence as it applies to different areas, not just an overall sense of competence, but competence in different domains of, it could be school, it could be physical competence, it could be social competence, but this is something that children are really challenged by during this period of life. Another part of what's happening developmentally, and this really applies to what happens at school, is that children are starting to incorporate other people's evaluations of them into their developing sense of self. This is part of the social cognitive changes that children are experiencing during this period of life. What other people think about them and how other people act toward them becomes internalized, and it's part of what they think about themselves. You can see how that operates with this sense of competence. The last piece of information to keep in mind is that during this period of life, children are also developing a far better understanding of stereotypes and what stereotypes are and how stereotypes operate during the course of interactions between people. For example, if an individual, say a child is observing an interaction between 2 people, and one person behaves in a particular way to the other person, and that other person's a member of a marginalized or stereotyped group, children start to understand that, wow, that person thinks this way because most people think this way about people who are members of that group. So children are developing a sense of what stereotypes are and how they function during the course of everyday interactions. For children who are developing weight problems, the school setting is particularly important because it's the place where most weight-biased stigmatization occurs. And so for children who are developing weight problems or who have weight problems, it's a really anxiety-provoking place to be. And we know that children spend a lot of time at school. One of the studies, probably one of my favorite studies, that shows what this means for children in terms of their opportunities to develop socially comes from Strauss and Pollock in 2003. Some of you might be familiar with the adolescent health data set. It's a longitudinal data set, big sample. They collected a subsample of data at the school level with actual interviews with kids, where they asked kids to talk about who's your best friend, who are the members of your social network. And what they found is that if you look at the dark dots, the dots that are black, these are the dots that represent the youth who were overweight or obese. The dots that are open are the non-overweight and obese kids. You can see pretty clearly that the children who have weight problems are on the periphery of the social network, and they're also not as well connected to other children. And the implications of that for children's development is they just don't have the same opportunities to develop social skills and to develop friendships. It's almost like an issue of access. Because of the way weight bias functions in our society, children who've developed weight problems are really literally marginalized. And I think this graphic really sums that up. When you're looking at children who are a little younger, those were adolescents. The first study that I did with my colleagues, Jennifer Krull and Yiting Chang, we used the Early Childhood Longitudinal Study kindergarten cohort. It's a large national data set the United States Department of Education sponsored, and lots of different federal agencies paid in to have data collected. The USDA had the actual heights and weights collected. The kids entered kindergarten in 98, 99. There were 22,000 kids at the study beginning. Over time, obviously with attrition, the sample size dropped. But with the real heights and weights, you're actually able to collect information about children's BMI and what that looked like over time. So we were able to create groups of children with, we called them weight status groups. And here you can see there's a persistent group, and these are kids who are basically, their obesity or overweight status appeared in kindergarten and maintained all the way through. Those are the open diamonds. The children whose obesity appeared at third grade or in the later onset group, and then these are the never overweight kids. And teacher reports showed that for girls in particular, in this study, that both weight groups were viewed by teachers as being less socially skilled than their non-overweight peers. And this is just the idea of being able to get along with other people, being able to get along with your teachers, handling conflict, monitoring your own emotional regulation during the course of interactions. But this was an interesting finding for us because it applied only to girls. We did not see a similar effect of weight status on boys in terms of teachers' perceptions of their social skills. However, we also looked at internalizing behaviors. And internalizing behaviors, and this is not, please keep in mind, this is not a clinical definition of internalizing or internalizing disorders. This is simply internalizing behaviors as noticed by teachers and rated. And what we found was that the persistently overweight or obese children were rated by teachers as showing more sadness, loneliness, and anxiety than their never overweight peers. And those effects got larger over time. You can see, again, the persistently obese children are the top line with the open diamonds, and those are the children that teachers saw exhibiting more of those kinds of behaviors. And these are different teachers. There's a kindergarten teacher, first grade, and third grade teacher. So this is some research that we conducted in our lab that had to do with looking at those intra and interpersonal aspects of development that are important during the school-age years. So then we asked ourselves, what do we think this means in terms of a more multivariate model of child development? When you are interested in developmental systems, one of the things you learn very quickly is it's hard to isolate one thing. Because one thing typically influences or is influenced by something else. And so what we decided to do was add in the variable of math performance. And the reason that we selected math performance is that in the social psychology literature, math performance And when I say math performance, I'm talking basically about how people do on math tests. We don't know if it's a pure measure of achievement or ability. It's how they perform on the test. And social psychologists have set up different types of experiments looking at different groups of people. They've used a math performance outcome looking at different racial groups who get different instructions about completing a math test. The math test being just something we want you to do versus a math test being a real indicator of what you know. But it's an outcome measure that is believed to be affected by attentional processes. And so if anxiety is introduced, your attentional processes might be stressed. And because of that stress, you may not perform as well on the task that you're being asked to perform. And so that's why we selected math performance as our outcome. And this is what we call a mediated model. So what we were doing is we were really trying to find out, number one, is boys and girls' weight status directly affected, or does it have a direct relationship with math performance? And we were looking over time. We added the 5th grade data on. So we're looking at boys and girls' weight status and their math performance. But the question that we were really interested in was finding out what happens to this relationship, the C-path, which is kind of the statistical terminology for mediation, that direct main effect. What happens when you add in these other variables? What happens to this relationship? And so, again, we used the early childhood longitudinal study cohort, and I just wanted to give you an actual picture to give you a sense of how those weight status groups were created that I just talked about. So basically, this is a sample of over 6,000 kids. And it's so nice, that's probably the nicest thing about secondary data analysis is you get these really large samples, and you can do a lot with them. We were able to break them in half by gender, boys and girls, and within the groups, we had the kids, as I mentioned before, that were persistently overweight or obese. Basically, the obesity had to emerge during kindergarten fall, kindergarten spring, or 1st grade spring and stay. They had to remain in that category once they got into it, because if any of you are noticing the big standard deviations, I just wanted to explain that's why they're there. As you can see, these are kids at the end, they're all in that obesity category by here. And then these are the kids who were never overweight or obese, and then we had that later onset group. Who in kindergarten had a body mass index percentile, in the 70s, but by the end of the study, they were all above that 95th percentile and remained there. And so what's nice with data like this is you can compare groups over time, you can compare groups within time. It permits many different types of analysis. And for anyone who's interested in that, the questions about how we analyze these data, because they're clustered data, it's used hierarchical linear modeling and multi-level models, and it's actually kind of fun to do. But I'd be happy to answer any of those questions. And so now I want to go through the results. What were the results that we found from this study? So we're going to begin here with just that C-path, right there, just that direct relationship. And basically what we found is that, yes, boys and girls' weight status is negatively associated with math performance, especially for that persistent group. And I will actually just be limiting my discussion of the results today to only that persistent group, because the later onset group, interestingly, the results were not easy to interpret because they were transient. In some instances, at different time points, the obesity effects emerged, but then by the next time point, they were gone. And we had a difficult time interpreting those, and we also, the sample size for that later onset group was not as robust, and so it could have been a sample size issue. But for now, I really am going to focus on that persistent group, and these are the kids whose weight problems appeared early and stayed in place. And interestingly, too, when you consider time, because time was a very important variable in our analysis, that persistent group, the effects of the weight status did not emerge until 1st grade. So even though all these kids were, having weight problems pretty early on, if you look across the kindergarten rows, like for the persistent group, they were all at least overweight or obese. What you see, though, is that those negative effects did not appear until 1st grade. And, does that say something about the social context within which children were experiencing their school lives? We don't know, but that's how the data played out. And then let me show you what happened with the girls. And again, it's the exact same model. And what we found for the girls, we both replicated the earlier study that included up to 3rd grade, meaning that the girls were also, even at 5th grade, were still being viewed by their teachers as having poor interpersonal skills, and they also were exhibiting more internalizing behaviors. And in terms of mediation, what does this mean? Basically, what it means is the main effect that we identified when we looked at just that relationship, in our analyses, when we included these variables, and they were included separately, not together, we ran 2 separate models, one for interpersonal and one for internalizing, the size of this relationship decreased. And the size of that decrease was a significant decrease. However, it remained significant, which means it was partial mediation. It was not full mediation. And so that told me there's still things that need to be explained, possibly. But that's why I say it just explained part of the relationship. So you can see that even though that relationship still held, by adding these other variables, these social emotional factors, which are incredibly important for children during these school-age years, they did account for some of that relationship. And then for boys, and this just looks exactly the same, but the results are slightly different. Again, we replicated that earlier finding that showed there was no relationship between boys' weight status and how teachers viewed them in terms of their social skills. But we did see a relationship, again, with the internalizing behaviors, and that was also a replication from up until 3rd grade. And for boys, that was the only social emotional factor that reduced the size of the relationship between these 2 variables. So again, it was another example of partial mediation, but it shows the complexity of how obesity in childhood can touch all of these different areas of development, and how these different areas of development can have pretty significant consequences. And so with that, I'd like to just conclude with some implications from the study, and then I'll take questions. So again, and this is a theme that we've been hearing throughout the conference, early onset obesity has particularly notable implications for children's development. We heard a lot about that in this session before lunch. There are multiple implications for child development. Like I said earlier, that later onset group, we just were not able to make a lot of sense out of that. The ECLSK, however, goes through 8th grade, and so there are other opportunities to do further data analysis. And then again, the mediation effects were partial. The adding in those social emotional factors did not completely reduce the size of the relationship between weight status and academics. And so for me, like I said earlier, that does raise questions about what that relationship could possibly be about. I believe it was last year, meaning 2013, there was a paper published looking at school absence. I believe it may have used, I can't remember the exact source, but I talk about this in my class, and that's that children, school-age children who have weight problems are absent more frequently from school than children who do not have weight problems. Why they're absent, the paper didn't go into that. But again, it gets at this idea, it's sort of like the social network graphic I showed earlier. If children are missing school more often, they're not getting the same level of exposure to the learning environment that their non-overweight and obese peers are getting. So that's a question that could actually be answered with the ECLSK. I haven't done that myself, but they do have school absence data. And then the third question, and I want you to be thinking sort of in that framework of human capital formation, how does stress of membership in a stigmatized group accumulate? One of the things about that internalizing behaviors finding that for me was really concerning is that it increased. Children who had persistent obesity were showing increasing amounts of internalizing behaviors. And this is between kindergarten and 5th grade. I mean, these kids still have presumably 7 more years of education, through high school and then whatever comes next. We know that membership in marginalized groups is associated with living a more stressful life, and I think there is data showing greater risk for the onset of things like depression. And so what does this mean for our children who've got weight problems? What's happening to the accumulation of these potentially harmful intrapersonal characteristics? What happens over time? And then the last point I wanted to make had to do with the long-term implications associated with math achievement. I'm actually at a point in my career where I'm trying to integrate two different areas of research. I have a research program in childhood obesity, and I also have a research program that looks at childcare and early education policy. And I'm really interested in a lot of the work that's going on. We heard about from the woman from the American Heart Association, Nancy Brown, talked about the work that they're doing with childcare programs. And I'm also really interested in integrating obesity prevention approaches with the childcare setting, and in particular with numeracy and numeracy development, and how can we take those 2 years of pre-K and integrate, the real question is, can you integrate number learning with physical activity? You know, can you do that? Do children learn their numbers while they're also having fun being active, or would they prefer to be active without anything else going on? So I'm kind of shifting into that direction, to more of a prevention intervention focus. So with that, thank you very much, and I'll take any questions. Yes? That's a great question. I do not know. He just asked if classroom size or teacher-to-student ratio plays a role in any of the teacher ratings. I presume, I don't know. I did not look at that, and I think you can look at that. The Early Childhood Longitudinal Study has a lot of classroom-level data. So that's an excellent question. We clustered at the level of school in our analyses, but we did not cluster at the level of classroom or account for any of that. Yes? Excellent question. He's asked if we looked at externalizing behaviors as well as internalizing behaviors. I didn't report those findings today, but from our 2009 study, externalizing behavior problems, I can't remember the girls' results because they were not easily interpreted, but as far as the gender effects of membership in the persistently obese group for boys, guess what direction externalizing behaviors went? Down. Over the course of kindergarten through 3rd grade, the boys who were members of the persistently obese group showed decreasing levels of externalizing. And externalizing is kind of what I call acting out. And it went down. And that was compared to the late onset group as well as the never overweight group. And I think developmentally, you kind of anticipate some increase in boys externalizing, and we found that result really intriguing because it suggests that these boys with the persistent obesity are kind of standing back a little. You know, they're not acting out. And keep in mind, that's just between kindergarten and 3rd grade, so who knows what it would look like later. So, yeah, yeah, they could become the bully. Yeah. Any other questions?
Excellent talk.
Yes.
I was wondering, so we have this obesity epidemic happening, and so we have more and more kids looking like each other being obese. And so have we got any sense of that that word?
Stigmatization.
Thank you. That sense, is it really happening to the level it happened a few years ago when they were the odd duck out, and now they're more like their friends?
That's a great question, and so there was a very famous study conducted in the 60s, and I think, can anyone help me out here? Dornbush and Richardson, that looked at how school-age children felt about children who were, quote, chubby. And they were rated last as being a potential playmate. That study was replicated, I want to say, in the early 2000s, I think by Stunkard. As I'm getting older, my name recognition thing is not as good. But basically, it's not changed. It has not changed. Being a child with weight problems, and that doesn't mean the 95th percentile or above. It's in the eye of the beholder. If another child thinks you're chubby, they're going to have thoughts about who you are as a person and your character. And one of the ways I think that this is, I don't like to put too much emphasis on this because I don't know like the empirical side of it, but the media plays a really, really big role in conveying body image ideals. And we know that even younger and younger children are being affected by that and are seeing those idealized bodies that really are not very realistic. So from my understanding of what we know is that it has not changed. So are there any other questions?
Over here.
I should probably need to stop. Yeah.
One quick one. Is there any evidence that persistently obese children are more likely to commit suicide?
I'm not familiar with that literature. I'm sorry, I can't answer that question. Okay. Okay, thank you.